Hello, this is Doug Nelson, and I want to thank you very, very much for your interest and participation in precision neuromuscular therapy for the knee, the leg, and the foot. This class is essentially part 2 of our lower extremity seminar. In part 1, we focused on the muscles in the area of the hip, but in this seminar, we're going to focus on everything from like mid-thigh and down, but especially like 2 main areas of focus. Number 1, of course, is the knee itself, the ankle, and then the foot. So let's start with the knee. The interesting thing about knee issues are there are many different kinds of problems that a person might have. And they're generally of 2 categories. Intra-joint, things like meniscal problems, a problem with one of the internal ligaments, like the cruciate ligaments, that sort of stuff. Or extra-joint issues, issues of the muscles and ligaments and tendons around the joint itself. Here's the interesting thing. Many of the symptoms that people have are actually extra-joint issues. The intra-joint issues aren't something that we can really do anything about, but the extra-joint issues often mimic more serious internal issues. What that translates to in terms of your practice is there are many people walking around with knee issues, for instance, who think that there's really no recourse, no path of action for them because they think that they're stuck with some whatever arthritic changes or some internal problem that really cannot be helped. And they're surprised and delighted when they find out that specific, precise, soft tissue work can make a difference. And that's really what this seminar is all about. So when you look at it, we'll divide that area by region. So we'll look at, for instance, all the muscles and structures that might present with medial knee pain, all the muscles and structures that might present with lateral knee pain, front of the knee, and then the back of the knee. Each one of these things, if you take medial knee pain, there are multiple structures that might cause that. So what we help you to do is figure out who the possible culprits are and how to triage, how to assess your way through that process so you can find out how to be the most efficient and the most effective creator of treatment possible. That's our key is always about being efficient and being effective. So the knee is a great focus for this seminar. And I think, again, what we hear from therapists is that they just didn't realize how much manual therapy can help a multitude of problems. And it's often an area that many people don't feel very comfortable and confident in. And this will give you tools to really make a difference for your clients who present with these symptoms. Of course, when you get to this area, the other thing that we're going to be looking at are posterior tibialis issues, gastrocnemius and soleus issues, big time players. And again, in our presentation, the way that we look at things, we're going to show you multiple ways to access these muscles. First, what's the functional physiology? Number 2, what are the symptom presentations? And number 3, we'll show you a very flexible treatment approach in multiple positions for them. Not that you'll always use every one of those positions, but the thing is you need options. You need multiple ways to do things so that what works for one person doesn't work for the other person, or this person can't lie on their side, or they can't lie face up or face down. Whatever they can or cannot do, you're good with that because you've got options. That's what artistry and mastery is all about. Of course, all of these muscles are then converging at the ankle, and there are ligaments that are commonly injured in inversion sprains, for instance. We'll deal with those things. And then we'll look at pain patterns of the foot itself. The foot is an area like the hand and arm where there are so many muscles and it's so complex that you can kind of get lost in a sea of data, not all of which is really relevant and applicable. So what we're going to do is we're going to take specific muscles of the foot that are major players in common pain presentations, so that if you learn it that way, each thing you learn has meaning. This muscle has this presenting symptom, this muscle has that presenting symptom, and these are things that you'll commonly see in the office, therefore you're going to use them. So we're going to spend our time on the 85% of things that are things that you're going to see in the office, and not waste time on things that really are exceedingly rare. So I think in that way you're going to walk away with the most useful information possible. And the foot, of course, is an extremely intricate area of the body, and there's a way to do it in a very general way, which feels fabulous, and that's all good. But if people present with very precise symptoms, you need to deal with that kind of thing in a very precise way. And that's, of course, what we're all about. It's not meant to take the place of more general work. More general work is wonderful, but if you're solving specific problems, you need a specific approach to do that. So enjoy the seminar. I think you're going to love it, and I know it's going to help the people that grace your treatment room. Thank you very much.